How's it going, modern manual therapy viewers? Dr. E here, back with a type of stop thought viruses, means of educating patients on why they should stop stretching or fighting high tone or tightness. In the eclectic approach or modern manual therapy, there's really no difference between an orthopedic patient and a neuro patient. The orthopedic conditions, like MSK conditions that would fall under those types of pathologies, they have the chance to rapidly respond or rapidly recover versus a neurologic condition like stroke or cerebral palsy. They tend to have higher tone and they may not recover as quickly because there's an underlying neurologic pathology or disease process going on. However, the rules for tone are the same for neuro and ortho. And every time a neuro or peds therapist walks into one of my courses, they typically kind of say, hey, I really get this. And initially, I just took the course because it was close and I needed CEUs, but I think I can really apply this stuff. Orthotherapists tend to stretch things as hard and as fast as they possibly can, potentially if they're doing manipulation or if they're doing soft tissue work. They think that more is better. But a neurotherapist wouldn't take high tone and stretch it hard or fast because they know that overall it would just fight back, or the tone wouldn't release, and the tone would finally release or decrease possibly when muscle fatigues. And the same thing goes for ortho patients. If an area is under threat, perceived threat, there's high tone. And why would you stretch it as hard as you can? So I like to use finger traps as an example for that. Because many times, say if someone has upper trap tightness, right cervicogenic headaches, the directional preference is typically retraction and side bending to the right. And what the patient may have been doing is basically upper trap stretching, levator stretching, and kind of stretching away. And I will say, would you take a muscle? A muscle is under high tone or under threat is very similar to a string. Pulling it as taut as possible and then pulling it even more taut to try and loosen it up. So I like to use something like this as an example. When a muscle is under guard and it's already taut, if you keep on pulling it and pulling it and pulling it, you're just fighting it and it will tighten up even more. So I like to use this for directional preference and also positional inhibition, what some others call functional release, and in commercial models it's called counterstrain. Slacking the muscle can get rid of trigger points. Slacking the muscle can get rid of that perception of tightness. So you slack and then you can get free. So another way to use this is basically, why fight it? You have a condition. Accept it. Stop fighting and fighting and fighting. Once you kind of accept it, get moving, loosen up a little bit, relax about it, kind of decrease your anxiety about it. And of course, it's not what you would say, but once that happens, things just tend to release a bit better, then you can get moving again. So I first got this idea from David Butler, and I think it's a great idea to a visual analogy and also a tactile analogy for why a patient needs to stop stretching their IT band or their piriformis syndrome so much and maybe slack it. Slacking might be a better directional preference, might be a more novel stimulus that ends up letting it go. I hope this was helpful. Make sure to subscribe to Modern Manual Therapy. Follow us on social media, modmt.com/Facebook, Instagram, YouTube, or Twitter for your social media platform of choice. Make sure to subscribe via email so you don't miss any of our awesome blog updates. Check out all our great products for clinicians, strength coaches, movement-based therapists on edgemobilitysystem.com. I hope to see you at an eclectic approach course soon. And as always, you have an awesome day.